Hello and welcome to Anatomy and Physiology at Glen Oaks Community College. I'm Dr. Ren Hartung. For this video, I'm going to use this muscle man model and this visible woman model to show you the major regions of the human body. I'm using these models particularly because these are what I usually use in class to do my testing. The visible man and woman models are nice and cheap and they got the whole body, and of course the muscle man model has the whole body. And major regions, I'm talking about major surface regions of the human body. Let's get started. I'll start from the head and go all the way down to the toes, and we will be, at the end, I'll do some quizzing so that you can test yourself. Let's start up here. Up here, the top of the head is the cephalic region. The back bottom of the head is the occipital region. On the muscle man, up here on top would be the cephalic region. And then down here, the base of the skull back here is the occipital region. Left and right orbital region. On the muscle man right now, you can see the left orbital region, his left eye basically, also known as ocular region, by the way. On the visible woman model, there's the left ocular region, or left orbital region, and here's the right orbital region. The nasal region, of course, refers to the nose. The oral region refers to the mouth. So on the muscle man, there'd be the nasal region and the oral region. Otic. Otic refers to the ear. So this would be the right otic region and the left otic region. And then on the muscle man, you can see nicely the left otic region. One of the few places on the muscle man that he has skin. From otic region, buccal region would be the cheek. So this would be the right buccal region and the left buccal region. The mental region refers to the chin. I often think of the thinking man sculpture where he's got his fist under his chin. That's the mental region. Mental region. For mental region, let's do cervical, the neck. Cervical region refers to the neck. It's the entire thing. So whether your instructor has the sticker on the front of the neck or the side of the neck or the back of the neck, all of that is cervical region. Right and left acromial region. Now we're on to the shoulder. The acromial region is the part of the shoulder that's on top and that feels kind of bony usually. In fact, on the muscle man, it might be even better. This would be the left acromial region. This collarbone leads up to that acromial region, and the scapula contributes to it as well, acromial region. And it might be nice to compare that to the lower region down here where we have a fleshy muscle. That's the deltoid region. The deltoid region, by the way, is also where you get your flu shot or your tetanus shot. So this would be the right deltoid region. On top is the right acromial region. This would be the left deltoid region and the left acromial region. Moving on to right and left axillary region. Axillary simply means underarm. So this would be the right axillary region and the left axillary region on the visible woman model. And this is the left axillary region and the right axillary region on the muscle man. For my students, I usually like to use the muscle man more for this because you can see his armpit is more visible in both cases. Excuse me. Let's see, the next is brachial. Brachial means upper arm. So this is the left brachial region and the right brachial region. From brachial, we could go down to antecubital region. Antecubital means the crook of the elbow. So this is antecubital region. This would be the right antecubital region and the left antecubital region. Antebrachial means the forearm. So down here we have the left antebrachial region, and on the other side the right antebrachial region. Carpal region refers to the wrist. So this would be the right carpal region and the left carpal region. And then down in the hands we have digital region. This would be the left digital region and the right digital region. Moving back up here, I kind of pass to the thoracic region. Thoracic means chest, also called thoracis. The thoracic region has a couple of regions inside of it, the left and right pectoral regions. Under here we would have the pectoral muscles, and we have the right and left mammary regions, referring to the breasts or the nipple, of course. Down here we have the abdominal region, your belly. And there's a bunch of other regions down in the abdomen, and I will bring over the abdomen pieces that I have for that. Or actually, I could use this muscle man model pretty nicely. There's the umbilical region where the belly button is. And there are two different ways to deal with regions of the abdomen. One of them is to use the quadrant system. And simply to use the quadrant system, you, in your head, make a cross over the belly button with the belly button in the center of the cross. And that gives you a left upper quadrant, a right upper quadrant, a right lower quadrant, and a left lower quadrant. In my lab, I usually use the torso model bellies for this, so I'm going to go get those. This is the belly off of one of my torso models, and I've used some marking tape to put that cross on there. Of course, if this was a real patient, you just do that in your mind. And again, we have the left upper quadrant, or LUQ, the right upper quadrant, or RUQ, the right lower quadrant, or RLQ, and the left lower quadrant, or LLQ. That's one way to do the regions of the abdomen. The other way to do the regions of the abdomen is to, again, in your mind, if it was a real patient, you do this in your mind, but you make what looks like kind of a tic-tac-toe board with the umbilicus in the center square of the tic-tac-toe board. This square here is the umbilical region. Above it is the epigastric region. To either side of the umbilical region are the lumbar regions, so this would be the left lumbar region and the right lumbar region. Up here in these upper corners we have hypochondriac. This is the left hypochondriac region and the right hypochondriac region. And then for this row across the bottom, below the umbilical region we have the hypogastric region. And then on either side we have what's called either inguinal or iliac regions. So this would be the left iliac region or left inguinal region. This would be the right iliac region or right inguinal region. And those are the regions of the abdomen, the 9 regions of the abdomen, and the quadrants. So we're done with we're done with abdomen. Let's move on. Pubic region is just below that hypogastric region. It's down here where the pubic bone is. You could say it's maybe just a little bit north of the genitals, or to some instructors it may encompass also the genitals, of course. That's pubic region. The coxal region, that refers to the hip. So we're over here on the side now. This is the coxal region. This would be the right coxal region, and over here is the left coxal region. Inguinal region. The inguinal region, you could think of it as this valley that's created between your belly and your thigh. That's the inguinal region. It's also known as the groin. So this would be the right inguinal region or right groin. This would be the left inguinal region or left groin. I move my back foot. Oops. Femoral region refers to the thighs. So this would be the left femoral region and the right femoral region. And I'm pointing on the front right now, but the entire thigh is femoral, whether it's the back or the front or the side. So this would be the back of the right femoral region, back of the left femoral region, and so on. So that's femoral. The knees. The front of the knee, of course, is called the Patellar Region, so this would be the right patellar region, and this is the left patellar region. The back of the knee is referred to the popliteal, so this is the left popliteal region and the right popliteal region. The lower leg, that's crural. The lower leg, the entire lower leg is crural. So this would be the left crural region and the right crural region. You may also have to know sural. Sural refers to the calf, the meaty back part of the lower leg. That's sural. Moving down to the feet, first we'll talk about the ankle. It's called the tarsal region, sometimes also called the malleolar region. The heel is called the calcaneal region. So again, keeping up with the right and left, this is the right tarsal region and the left tarsal region, tarsal meaning ankle. This is the left calcaneal region and the right calcaneal region. Top of the foot is pedal, so this would be the left pedal region and the right pedal region. The toes are digital, so this would be the left digital region and the right digital region. Notice that the hand's digital region has the exact same name as the foot's digital region. And the bottom of the feet we call plantar. So this would be the left plantar region and the right plantar region. And I think with that, I think I've gone over all of the regions. Oh, I've missed some on the back here. Sorry. Let's go through it. The gluteal regions. This is the right gluteal region, or the right butt cheek. This is the left gluteal region. The lumbar region is here. It's the lower back, but it goes all the way around to the front. Remember, it is part of those 9 regions of the abdomen. This is the lumbar region of the abdomen, lumbar region of the back. Still on the back, this is the right scapular region, referring to the shoulder blade, and the left scapular region. On the muscle man, right scapular region and left scapular region. Another one I forgot from the back is the vertebral region or spinal region. And lastly, at the bottom of the spinal region, we have the sacral region. The sacral region is found below the lumbar region, but above your butt crack. That's the sacral region. Underneath it is the sacral bone. Let's look on the muscle man and see if he has all of these basic regions. There's the right and left gluteal region. Here's the spinal region or vertebral region. Here's the lumbar region. And here's the sacral region. And I think with that I have actually gotten all of them covered. Let's have a quiz. So I'll ask for the name of I'll point to a region and ask for the name, and then I'll give a pause before I give the correct answer. Let's start, I guess, here. What would this region be? If you said the right inguinal region, you're correct. You could have also said right groin. How about up here? If you said left pectoral region or even left mammary region, you're good. As long as we're here, let's do this one. What's this region here? If you said the sternal region, you are correct. Mediastinum would be incorrect in this case, by the way, because we're not looking inside, we're looking at surface regions. Mediastinum is an internal region. How about this whole region here? If you said abdominal region, you were correct. How about this region? This is the right digital region. Right digital. How about here? That is the left antecubital region. Left antecubital region. How about here? That is the left patellar region. And as long as we've done that one, let's go to the back and do this one. That is the right popliteal region. How about here? Correct answer is the occipital region. And how about up here? That is cephalic region or cranial region. What region is this? Correct answer is the right scapular region. And as long as we're doing that, let's do this. What region is this? It'd be the left scapular region. And how about, let's bring the muscle man into it a bit. How about this region? If you said left otic region, you're correct. How about this? If you said the oral region, that's correct. How about here, the chin? If you said mental region, you're correct. How about here? It might be kind of a tough one because his arm's up. But that would be the right deltoid region. And if that's the deltoid region, then what is this one? And that one is the acromial region. Acromial region. How about here? Correct answer is the spinal or vertebral region. How about here? Not here, but here. The answer is sacral region. How about this area here? And that would be the right femoral region. How about here, the lower leg? It'd be the right crural region. What about the calf? What do we call that in terms of region? It's the right sural region. And let's keep going down. How about this region? It's the calcaneal region. And how about here, the bottom of the foot? In this case, it's the right plantar region. And as long as we're there, how about the top of the foot? In this case, right pedal region. And then how about toes? Right digital region, left digital region. You may have noticed that I always try and do right and left. The reason for that is I want my students to really recognize that there's a big difference between the right and the left. And I expect them to be able to recognize the right and left on any model or dissection because it's important. Medical errors are the major reason that I do it. There are even now occasions where someone has surgery where they should have had surgery on the right hand, for example. They might accidentally have surgery on their left hand. We want to try to avoid that as much as possible by making sure we're really specific as to what part of the body we're talking about. In this case, what region are we at? We are at a patellar region, but more specifically, we're on the left patellar region and not the right patellar region. If you make that mistake in charting down the road, you might get somebody in trouble. How about this region? The answer is the right gluteal region. How about this region? left gluteal region. How about we do quadrants? And I'll try and make it a little tougher by giving you something other than those abdomens I showed you earlier. How about here? What quadrant are we in? If you said left upper quadrant, you're correct. How about down here? It's the right lower quadrant. And how about we bring in the, I'll bring in the abdomen for the 9 regions. What region is this? If you said left lumbar, you're correct. What region is this? If you said right iliac region or right inguinal region, you're correct. How about here? That center region is the umbilical region. How about up here? That's the right hypochondriac region. How about here? The hypogastric region. And here, the hypergastric region. Quiz yourself on these as much as you can and learn it well so that you do well in your lab exam. As always, if you have any questions or any comments, please leave them in the comment section down below, and thank you once again for watching.